Stretch. Okay, so once you get the belt, open it up. Unfold the belt. On this side, you have no material, no hook material, but on this side, you do have the hook material. What I'm gonna have you do is go to a plank position, raise up. It goes under the person, back down. I put the belt not up here and not down here, but right here in the middle. You take this, you can see if I go over this way, the belt's too long. But if I double it over or fold it over on one end, the belt is now positioned right where it's supposed to be at. So take it, fold it over this way. So now it's perfectly on his body. So you have the hip pocket here and the hip pocket here. Place it right here. Now it can be placed here, or it could be further under if you want, and you want to be able to adjust it. Remove that. Let's adjust it right now, actually. Okay, so now we have this much leverage on him, and you can see how his body's already starting to twist by just holding the belt that direction. You have two different types of pulls. You have a static pull and a glide pull. Right now we're going to demonstrate the static pull. If you do that, your hand is going to slip off. So if you remember, the hidden pocket holds the gripper. The gripper lays there. What we're doing is stretch and pulling it. Now I don't have to worry about it slipping because it's not going to. And I go up a little bit. And I go up a little bit. Okay, understand that nothing gets yanked. It's all nice and slow, steady pull. No one gets hurt because everything is nice and slow. You can have them breathing in and then breathing out. I'm just holding that pull. Breathing in, breathing out. Nice steady pull like that. And then I go up to the next area, about a ½ inch up. Breathing in and breathing out. So, like I said, once again, we're going straight down with this pull and straight back with this handle. Just like that. If you notice, my arm is barely bent. If I'm doing this, you don't want that. You want to be able to extend that arm out. And so in order to extend it out, I just twist my torso a little bit. Just like that. Twisting this lumbar area up. And if you'll see, on each side of the spine, you have what we call a laminar groove. You can feel the little knobby parts of the spine. Right here is the erector muscles on this side and on that side, and the spine is located right in the middle. So I take my palm right here and I place it on this area. And I pull. I'm actually pushing and pulling at the same time, at the exact same time, and sustaining this hold right here. Okay, so what we're going to do is, the belt in this case, you just lay it over this way, or you can even fold this over if you like, but you can leave it open as well. I'm going to fold it over, apply a little bit of stress there, pull this. So I'm just counter-forcing it, and that right there is going to lock that down. So once again, we find out where the spine is at, which is right here, erector muscles. This is what we're trying to get a hold of on each side of the spine. So I place my palm right here, not here, and not on this side, but this side of the spine. And again, sustaining that stretch. And now we're going to get, I'm leaning out as I'm stretching at the same time. Leaning out as I'm stretching. You can take the gripper, fold it up, place it into the pouch. Place this hand on the table like a push-up, and then push your shoulder up. See this whole segment right here, all the way down, this whole entire segment is going up, and I'm just holding this, leaning back. Go ahead and push. Get some more right there. You go. 3, breathing in. 2, 1. And relax. Then we're just rocking the back. If you notice, I pulled so much on this side, she's twisted to go in that direction. 65% of our population tilt to one direction or the other, and they stay like that. And then you wonder why this knee and this hip or that knee and that hip's bothering you all the time. It's because you're twisted. The body needs to be pulled back. So if your back is bothering you and you go to the doctor and they want to operate on you or get you pharmaceutical medications, it's not going to do you any good. It's the muscle pulling that spine out of the way, okay? So muscle is pulling the bone structure. Bones cannot pull on bones, and taking medication to tell you that this is not hurting is not going to solve the issue either. We need to pull that body back over, and the only way to do that is manual therapy. What we're looking for, you have the spine right here. Like I said, the erector muscle's here, and here we're going to grab a hold of this erector muscle and push down. Okay, and let's put our hand here and do the stretch again. Once again, I'm pulling back and I'm pushing down that way at a 45-degree angle, holding on to this area of the body and pushing. Good. Breathe in and breathe out. Good. Breathing in and out. Put lotion on the arm. Okay, so I have a grip right here. I'm essentially starting right here, and I'm going to start sliding up. Just like that. Nice, steady pull. Good.